Post National Injury Prevention Day Fireside Chat. I'm Tracy Meehan, and I am thrilled to have you here with us today. National Injury Prevention Day just wrapped up, and if you're anything like me, your phone battery is still recovering from all the posts and emails and green light selfies. But seriously, though, it was really inspiring to see all the events and the partnerships and the stories and the green lights shining all across the country. But as we know, the real impact comes from what happens after that day. So, how do we build on that energy and how do we stay connected, stay visible, stay strong throughout the year ahead? That's why we wanted to have this chat. This is a moment to acknowledge that it is both challenging and an opportunity for injury prevention. And we know that many programs are stretched, that funding is uncertain, and that despite all of that, the needs in our communities are seeming to be getting bigger. But what gives me hope and what you'll hear today is that collaboration is one of the most powerful tools we have. And when we work together, we amplify each other's voices, we strengthen our impact, and we keep the field moving forward. We have an incredible group of leaders with us today who embody that spirit of partnership and innovation. And I'd like to welcome them. We have with us Taurine Creppy, who is the president of Safe Kids Worldwide. Mighty Fine, who is the Associate Executive Director of the APHA, and Kristen Rexing, who's the Executive Director of SAVOR. So thank you all for being here, and we're going to just dive right in. The first thing we want to do is start with a question for our audience. So Morag is going to launch the poll for us, and we want to know, what is your greatest concern for collaboration in the coming year? And we'll give you a minute or so here to fill that out. And Marek, I'll let you go ahead and just share the answers when you think most people have responded. Okay, so not surprisingly, it looks like workforce capacity, number one, followed by funding and engaging non-traditional partners. So followed by data and surveillance. So we are going to talk a little bit about most of those issues today. Okay, so I'm going to start by asking our panelists a few questions, and then we will take questions from the audience after that. If you do have questions, please put them in the Q&A. And yes, this chat is being recorded, so you will have it afterwards. Okay, so I want to start with asking all of you. We just finished National Injury Prevention Day. So looking back, what is one piece of momentum you saw during the day that you believe we can carry into the rest of the year? And Taurine, maybe we can start with you.
Hi, thank you everyone for joining. I would say the one thing that stood with me was that how we all came together and also looking out and seeing so many new partners who weren't as familiar about Injury Prevention Day. And so that was inspiring to see that I think a lot of our organizations and groups are seeing that there's so much that we can build upon with one another, and that while we're in these challenging times, that there is hope and opportunity.
I love that. Mighty, what would you say?
Maybe somewhat selfishly, I was excited to see us get some attention, and dedicated attention. I feel like having been in this field for some time, I've often felt like the underdog in some spaces when we talk about public health broadly. And all of us listening in and here today on this panel, we recognize the burden of injuries and how it's not always commensurate with dollars or attention, et cetera. So that's what one great takeaway for me was that people were paying attention. And to Taurine's point, folks in sectors that I didn't think recognized injury and its importance, the importance of injury prevention, I should say, acknowledged it as well. And so, again, maybe somewhat selfishly, I felt good that the work that I've been doing and others like are assembled here today got some acknowledgement.
I love that, and I totally saw that as well. So great, great answer. Kristen, what did you see?
Well, I really can piggyback off of Mighty and Trim because it was this like moment of this attention that was great. But I also think leading up to that moment was really exciting to just see the planning and see the diversity of who was coming to the table, who is being approached, and that there was this momentum that Mighty's talking about, that it's like things were happening. And so I think it was that like the lead up to it was really exciting. And then seeing it all come together just felt great. To be a part of both of those pieces was really wonderful.
You guys are setting this up nicely. We're going to talk about some of these issues coming through. Kind of on the flip side a little bit, what is the single biggest barrier or a big barrier that you're seeing right now that's preventing stronger collaboration across our field? And what might we do to remove that barrier?
Um, I can hop in here and start the conversation. I think that capacity is just really challenging right now. People um, are living in this level of stress and uncertainty, and we are seeing, unfortunately, job losses or shifting responsibilities, um, and just a lot of when you have uncertainty in general, it really makes everything stressful and limits your capacity. But then there's actual just not enough hours in your day and people to support that work. And so I think um, what I enjoy about the work that we do in public health is that it is so collaborative and that we build these amazing networks. Oh no. Oh no.
We can still hear you.
Oh, okay. Like I don't know why my computer is not happy. But I have a concern about just making sure that people are taken care of and have the ability to do the work because it is going to be increasing.
Yeah, and we'll talk about, maybe what ideas we have to combat that when we can. But obviously our audience is worried about that as well. Mighty, do you have thoughts on this?
Yes, I have a bunch of thoughts that are swimming throughout my head. But what comes to mind is a barrier, and this may be sort of granular on a programmatic level, and it's a duality that I think a lot of us in this space often try to balance. It's having an appreciation of injury and violence prevention broadly, but also advocating for your specific piece of that puzzle, whether it's firearm injuries, childhood injury, etc. And sometimes I think because to Kristen's point, resources are shrinking and folks are wanting to focus and make sure the issue that they're working on gets the attention that it deserves. I find sometimes that can work as a barrier because we're so accustomed to talking about our specific issues that it doesn't always connect back to the broader issue of injury and violence prevention. But the silver lining is during the acknowledgement, I did see that there were some posts that would call out specific categories of injury and violence prevention and then connect it back to the broader issue. So folks who were listening in or reading were able to acknowledge the importance of, let's say, firearm injuries, but also recognizing it as a part of a greater whole that needs attention as well.
Yeah, I think that's a great point. Connecting each other and figuring out how we connect to the larger picture, I think is going to be really important. Taurine, I'd love to hear your thoughts.
I think just to add to what Mighty and Kristen said, I like to find opportunity in this place of change for all of us. And while our work has not, to Mighty's point, have gotten as much awareness around it as we would have liked, because injury is always, to me, the last thing, but we also know it is the leader. And so I think we have to find our moment right now with organizations and with partners who really haven't had an opportunity to learn how what we do intersects with what they're doing. And so I think we find the path forward now to really illustrate our work in ways that we've never been able to. So I think connecting dots. So when you think about the work that we're doing and all of these issues, and I'll just stay on firearm safety. For a very long time, Safe Kids as an organization focused on unintentional injuries and injuries that were preventable and did not focus on firearm safety. But there is a place to align firearm safety because in our space, we need to partner with violence prevention and really help to illuminate the issue And the people that I'm talking to, the organizations that Mighty and Kristen are talking to, I think allows for us, I would say, I'm going to capitalize as many times as I can in this space of not knowing what injury does and really push forward now where people are willing to listen and collaborate.
As a comms person, I love that. And it's actually a question that I had been thinking about. I think we don't do the greatest job talking about injury prevention and what it is. I don't think people know what we do. So, how can we as a field do a better job of telling our story? Anybody have any thoughts on that?
I'm going to jump in really quickly, just in terms of an opportunity that I had yesterday. It's lived experiences. And when you find that storytelling opportunity, I was with someone yesterday who said, I'm coming back to give back because if it wasn't for the local children's hospital, I will be blind today. I am leading a company that does meal prep. And so I want to help food insecurity. I mean, he may not have thought about that in aligning it. But it was his lived experience that brought his work forth. It allowed me an opportunity to talk about what we do in injury prevention. So I think having the opportunity in storytelling, to your point, Tracy, but also having those that have lived experiences in injury help tell the story much better than we can.
Totally agree. The stories bring the issues to life, and I've been trained in epidemiology, so I love data, I love numbers, I love all the things, computations, and that all is significant and has a role. And I think when we're able to tell stories, it connects the dots for folks, and so they understand how this is playing out in real life beyond a peer-reviewed journal article, which is also greatly important. But I think the story makes those connections. And to Tareen's point, I think that's what connects to people and they're like, oh, I know someone like that, or makes it relatable. And then hopefully it spurs something in them to want to contribute to the solutions and addressing some of those challenges that we have in injury and violence prevention. So yes, I can think of times that I've gone to conferences, wonderful content was presented, and some of the things that were most salient to me were the stories that were told, connecting back to said issue area. So I think we can do more in storytelling, ensuring that we're connecting data to stories. And as Tareen mentioned, uplifting the lived experience so folks can have a totality of what's happening in this space.
Oh my gosh, storytelling is so unbelievably key. I just led a session yesterday to a bunch of researchers talking about putting voices behind the work that they're doing. As you know, funding is getting cut left and right, and people don't understand the work that we do has this direct impact. So we just spent an hour and a half creating relatable discussion around the work that's being done, getting away from kind of the point that you said, Mighty, all the heavy numbers say it has an impact, it's increasing or it's decreasing. And this is a specific piece of something that I'm doing. And a lot of our work is with communities and it's in communities. And so bringing in those voices is really critical. But I think it's just constantly talking about it in our own spaces. Like, I show up in places and people ask what I do, and you say public health, and people sometimes stare at you. And then you say injury prevention, and they really stare at you. So it's just like having these discussions. We're coming into Thanksgiving, like letting people in your orbit know what you're doing. It is really eye-opening. You talk to people and you're just like, what is that? And you say, oh, elderly falls or child safety, motor vehicle crashes, and you just see light bulbs go off. They're like, oh, that's like literally the stuff around me every day. And you go, yes, that's what we're doing. And we're having an impact on that. So I think it's having these broader conversations to decision makers and funders, but and communities, like just bringing it up to your family and they're the credible messengers, right?
Yeah, I want to
Absolutely.
add to that really quickly. Just in something that you said, and I think it goes back to you, Tracy, from a communications. I mean, I think we got to really now take the time to use some plain language. So you exactly just did that, Kristen, where you said, like, I do public health, I do injury prevention, but elderly falls, I'm going to relate to what it is versus the topic. So I think we can utilize this time and space that we've been given to really reimagine and refocus how we look at public health, injury prevention, and in a very tough time that allows us to come out of this stronger because we've been able to be clear in exactly what we do. So I think plain language has got to be part of what we do moving forward.
It's so funny that you just said reimagine because that was a conversation that I was having this morning. We were talking about, it can be really depressing to see so much loss or change and disruption. Um, but we do have an opportunity to reinvent and reimagine the world that we want us to live in, to age in, our kids to be born into and growing up in. And so there are these kind of like opportunities that I think we need to take a breath and think about like, all right, what can we do better? How can we do it differently? What are, some solutions or partnerships to make that happen? And so when I think of it in that way, it does kind of get me actually more excited about continuing through because it can be pretty daunting.
Yeah, there's a quote out there, and I cannot remember who said it, but it's nobody ever marched on Washington because of a pie chart, right? But I think as epidemiologists, many of us in the field, that's how we talk, and we think we're telling a story when we tell the data numbers, but it's not enough, right? We have to tell them, so what? Why does this matter to me? And I think we haven't done a good job of that, and that's why people don't understand, and that's why we're losing funding to some extent, right? So I
Yeah.
love to hear all of you and the stories and all of that, and lifting up the people who know how to do that and know how to teach us how to do that, I think is really important moving forward. But Kristen, I want to turn here a little bit. You, at the end of your comment, you started talking about partnerships and what that looks like. Savor, that is something that Savor does really well, building pipelines and partnerships. Can you maybe share some examples with us of some things that Savor has done to connect researchers and practitioners?
Yeah, I mean, I just look at this room right here, Safe Kids. We reached out and connected a few years ago and said, there's this gap here and we can be filling it and doing a better job. And so we've had this amazing partnership over the past few years with Safe Kids, bringing students into the fold, getting them excited, going to each other's conferences, supporting each other's work and basically introducing what each group is doing is like a very good first step. It doesn't take much, right? It's a quick email, it's getting together with someone, sharing out what you're doing, what your goals are, and understanding their goals. And so, Safe Kids is like, we really want to make sure that we have a research connection and that we know that groups are doing that, right? We don't need to duplicate efforts or create something when we know there's spaces. So it's finding those people doing that. So we've done some really great stuff with Safe Kids. We've done some work with APHA. We have a really strong relationship with Safe States and their practice partners linking with our researchers. So they have these regional networks, and we've been connecting them with our injury centers and having conversations around where are research questions that you want answered or connections to the research community. And so it's really funny because it's those simple things that really open up a ton of opportunity and build those connections where it's important to get the work done through those partnerships. And so those are some right off the bat where we've just been working to make sure that people are aware of who we are and what we're doing and that we're aware of who else is in the space so we can see where we can be supporting each other.
I think that's really important. I've been having personal conversations as well, and I've been shocked at people who have been in the injury field, even for a while, who don't know what other groups are doing and don't understand how we're all different and how we can all support each other. So I think it's really important for us moving forward to learn what other people in our space are doing and how we can work together.
Well, I think that brings up a point that Mighty brought up earlier. Around like what is injury. People within injury, I don't know if my colleagues here on this call and my friends on this call have had this happen, don't always identify as injury people, injury prevention folks. So having conversations with certain groups is very illuminating because they'll see themselves maybe in, more gender safety space or whatever it could be. And you're like, we're all working in injury. So I think having those conversations is so critical because we come at our work slightly differently. And so that identity of that work is sometimes not I think that you're doing injury, but you don't identify it as injury. You identify it as working in a child maltreatment space, and you're not seeing that as injury. So, when Mighty was talking about that, I was like, just us talking to each other is very, very interesting.
Yeah, I think, and Mighty said earlier too, just seeing the recognition, but of injury prevention, but also of these groups, right? I saw Safe Kids, I saw Saver, I saw APHA, I saw Injury Free, Safe States. Not everybody knows who all of them are, but it's time to lift everybody up. And there's people in each of those places who will come at things a little bit differently. So get to know people in your organizations and your bigger groups. There's a ton of connections out there. And sometimes we repeat work we don't have to connect and we can figure out how to do that, right? Kristen, I want to go back to one thing that you said because it's something that this group we've talked about before. We're hearing workplace capacity issues and even, kind of some fear of the younger generation of being in this space. So if you're an early career professional or a student, how can tapping into national collaborations like Saver or any of the groups that we've mentioned, how can we do that and what will that do for us?
I think, and I will answer my thoughts, and I'd love to hear from everyone else's thoughts. We're a professional organization and a nonprofit, so we have members that we connect and network and mentor. Prior to my current role, when I was faculty, I always had my students in my undergraduate capstone class find a professional organization, whether it be APHA or their local chapters or someone like Saver or Safe State, whatever. I said, find what you think you're interested in and start to connect to your profession in a way so that way you're building out these networks. And so I just think it's really important that we are making sure that we are creating space for early career folks, for students to be coming in and connecting. I do have a big worry. We're seeing, changes in the higher ed landscape, potentially MPH programs aren't going to be funded by a grant. Like this is a major concern. And when you have a workforce that's been so disrupted, there is a potential that even if it's an entry level position, it might not be going to an entry level person because a lot of more mid and senior folks are also looking. So I think that we have a responsibility as this community to we can't always create jobs or do things like that, but we can be keeping people connected. We can make sure that they are able to maybe stay sharp on their skills or be introduced to people and showing up in spaces, because that is a concern that I have is there is a potential for a shrinkage or a major loss in the vitality of our field, which is the early career folks and the students coming in, new energy, new ideas. And I do worry about that. And I would love to hear, I know APHA does a lot with students. And so we want to make sure that they stay connected. And I think that's really critical.
I agree. Yeah, that connection is a differentiator. I've certainly seen it at my long time here at APHA is is having a home. And I think it's reflected in any of the meetings that we've hosted. It's yes, it's a professional gathering space, but it's also like a family reunion in some ways where you're happy to see colleagues that you've partnered with or someone's paper that you read and you want to connect with them about your own research or your own work in general. And I think it's critically important for students and early career professionals to get connected to some professional organization. I feel like it helps to center them. It provides direction, networking, collaboration, and connection. I know I've made tons of connections from meetings that I've attended, whether I was presenting, moderating, or just simply attending. And I was also able to, through my involvement in a national organization or local for that matter, I was able to chart my own path alongside with mentors or even my peers who served as influencers in some way and helping me to think through what some next stages were in my career. So yeah, I can't overemphasize the importance of finding a professional home. Again, whether it's one of our organizations here and or some other group that can help to provide some direction and serve as a resource. The other thing too, I say to that, somewhat tangential, but what I tell my students is when someone asks you if you need something to let them know, actually let them know. I know I do that with my partners. I'm like, you know what? Kristen is really good at this, or she can connect me to this one, or let me call Tracy or Tareen or whomever. I'm not shy about connecting with folks who have offered to provide support for me, and that's something that I certainly encourage early career professionals to do is to engage in those spaces so they can get that support, but also think about how that connection or interaction can be bi-directional. So it doesn't seem like someone's always taking, but
Yeah.
how can we partner in this work together. So, uh, yeah, I again
It's
plus on that.
It's funny that you said bi-directional because I'm at a conference right now, which is why I'm in a hotel room. Uh, but I was talking about, I think that we have a role as the senior and mid-career folks in the room to be listening.
Absolutely.
This is an uncomfortable and unfamiliar space that none of us have experienced. And we do
Yes,
have a bit more power in
absolutely.
creating space and opportunity and taking that up the chain if there's a way that you can, you know, there's going to be challenges in academic spaces around tenure lines or promote whatever it might be, and where we can be listening to people's concerns, so bringing them in, connecting them, but also actively listening so we have an opportunity to maybe carry that message forward or help shape the new workspace. And I'll stop talking, but you just hit that nail on the head. Like,
Yeah,
that's what we
no,
need to do.
totally. No, I agree totally. The only other thing I'll add to that is in being authentic and truthful because this is uncharted territory and the answers escape us all, right? And we don't have a crystal ball and we can't look into the future, but that still doesn't prevent us from thinking through it collectively and serving as a sounding board or our listening partner. So yeah, I fully agree with that. We should open ourselves up to hearing what's happening because this is uncharted territory for us all.
Yeah, I'm glad you said authenticity, Mighty, because I think we have a tendency sometimes to not want to say the hard thing.
Yeah.
And I think in order for us to do this work together, we need to start building community and we need to start sharing the space because I recognize that we may have worked in silos in the past. And I think, Kristen, you alluded to like there are a lot of us who may not know each other or know different partner organizations. But I think this is a time like to find that opportunity to really harness all of us working closer in than further apart. So instead of going, I love the bi-directional because I feel like, I don't need to go start creating new research if Kristen's group is already doing it. How do I plus to your point, Mighty, it up? And so I think if we can set the standard that this is something we all need to do organizationally, there's no I in team. We're all one team and we bring our subject matter expertise together.
Yeah, and I will say I have been inspired by each of the three of you quietly doing this intentionally. I have seen Taurine lift up somebody because she can. And I've seen Kristen, give an opportunity to somebody who might not have had an opportunity otherwise, right? And, mighty connecting people, bringing people up that maybe we haven't heard from before, right? Being intentional about lifting up that next generation, I think will be incredibly important during this time so we don't lose people as well.
And I think that
Okay, I want to make sure
Tareen,
I give everybody some time to talk here. Taurine, let's kind of move over to you a little bit. Safe Kids, you've done a great job of building coalitions across communities and even countries. So right now we're talking about identifying new partners. How do you guys go about approaching finding new partners, maybe unique, different partners that we don't tend to think about?
Yeah, so let's start with partners that already exist that may have been dismantled in this place of reshuffling the deck around the work that we do in injury. And so, there's a lot of partners who were doing great work that may not have the opportunity to continue that work. And I'll speak really authentically around the water space. There were, a lot of change around water safety. And as we know, drowning continues to be a leading killer of kids. And what I encouraged all of us to do when each one were speaking to Marag and myself was that let's all come together. Let's put on a series of webinars. Let's share the work and what each of you are doing. And so I finding that, to Kristen's earlier point, there are a lot of partners out here that many of us have not worked with, may not know of. And so instead of, trying to do this work in a silo, I am using my leverage in my where I sit to bring us closer together and identifying, once we see who's doing a lot of the work that many of us want to do, how do we figure out where the gaps are and start to really plug and play and fill those gaps with partners that either exist or don't exist, that we need to think through, how do we continue the work. And so for Safe Kids, we've had over 400 coalition partners nationally in our network, and they are either based out of a children's hospital, healthcare system, health department, fire, EMS, or police, and some are their 501c3. But we're taking the time right now to reassess our partners, because within our structure, there are also local partners. And those local partners may feed up to a national partner. So are we duplicating our efforts? And are we taking the time to really assess and meet families and communities where they are? Because where these families and the parents and children we want to address or meet and give the advice, we may need to go to where those partners are and where they're going to get services. So we're really thinking through how to reset and realign our partner structure right now. So we're looking forward to rolling that out within the next year. But right now, we're doing a lot of homework and really identifying, and where there are partners that are potentially no longer funded for the work that they were doing, and we can fill in a blank on what that work might be. Maybe we need to find a way to lift them up, support them, and have them do the work instead of trying to do it ourselves. So we're really cascading a wide net of identifying. You have civic organizations, you have food insecurity organizations. I mean, right here in DC, we were concerned with SNAP and WIC that, we put out an ask to the Napkin Network. I never knew who they were, but they're a national network who collect formula, Pampers. And immediately on her social channel, she put out that there's a local organization looking for formula. And tomorrow we're picking up tons of formula that she's collected, but I wouldn't have never known her. So it's really identifying where's the depth and breadth and strength in communities that we can coalesce and start formalizing a national list, a local list, to help us be able to serve better than we had been. And I just want to emphasize with that question too, as it relates to partners. This is really, I want all of us on this call to just take a moment to not look so at what has happened, but what are we going to do about what has happened, and empower us to become stronger.
I love that challenge. Kind of building off of that, funding, you've been talking about that. Funding is a little bit of an issue, and you've already given, all of us have given some examples here of things that we can do around that. But one of the things we see sometimes is that we get that initial funding or that initial drive. We had National Injury Prevention Day, we got that to happen, but then the spotlight fades or that first round of funding fades. And that's, we have to figure out what to do. Do you have ideas around how you maintain that momentum? What do you guys do?
Yeah, I'll kick us off. I know many of us on this call and this panel, we sit on boards and we review proposals, and we've had an opportunity to be part of a selection. And I would say what I'm learning from where I sit is that we have to work more together in submitting proposals. We have to work more together in coming as a unified force, because the money is smaller, and it's going to get even smaller over time. And so the more you come together, you could, to me, increase the pot, because you bring more opportunity, you bring more ideas and innovation around the work that you're trying to do. Most importantly, I think we have to start with really identifying the outcomes and the impact that we're wanting to make. And it doesn't always have to be the dollars that get us there. It could be some of the work that we can do before we are reaching for dollars to be able to pitch and sell. I would say at Save Kids, I try to look for, multi-year funding, which is really hard to get. but I try to have that plan written in a multi-year approach so that I look at every dollar we're getting as seed money to help me build to the next. So who's the next funder that could be thinking about what I'm about to do this year to support it the next year so that it becomes a continuum of work that I'm trying to build on instead of it being just an event or a project that's one time. So I think you're always shopping your work and to not give up because again, if APHA and Saver and Save Kids wanted to go after a project together, I will tell you right now in these times, donors are looking that I didn't get three proposals from three different groups. I got one proposal that shows how these groups are going to interconnect and do the work together. So I think again, it's the collaboration that we're going to have to, I think start to work towards to show that doing more together is going to get us further along than doing less.
Yeah, Mighty, I'm curious from, APHA, that organizational perspective, same kind of thing where we do a lot of these like short campaigns or even, National Injury Prevention Day, great, great awareness. But now we're moving into that what next phase? What can organizations like APHA do around that?
Yeah, a few things come to mind. First is to ensure that beyond that day, the talking points, the programmatic as the programmatic approaches are woven into the other work that we're doing. So injury seen is seen as encompassed in the work that we're doing. And I will say it does sometimes it's challenging for groups like APHA because we're public health and there's tons of things that we would like to cover and support and our members will always let us know if there's something that we forgot. But the good thing about that is that we do have a dedicated injury section that works closely with other national organizations on behalf of APHA, and we're intentional again about ensuring that we're incorporating injury and violence prevention and showcasing the intersection or connection with that work and or those outcomes with other aspects of public health specific to APHA, but public health more broadly, so that folks are appreciating injury as distinct, but also acknowledging where it's connected and even thinking back to some of the shared risk and protective factors work that was starting to gain momentum again. That's an approach that APHA certainly has done and continues to do in helping folks to understand, again, the totality of the issue and embedded in public health more broadly. And so we do that in our work, but also having our member sections collaborate and connect. You'll see a very, very discrete example is sometimes within a specific section, let's say HIV, there's a subsection that focuses on the intersection of injuries or violence in HIV. So we're seeing more and more of that happening throughout the association, and there's more that we can do to elevate where those intersections and those partnerships are happening. So again, folks see injury as a part of a whole.
Yeah, I think that's really interesting. I had a conversation yesterday with Dr. Daria. She does a lot of social media, and she had a conversation about how quick some groups are to have their key messages ready to go and activate. She said she posted something, I think it was on vaccines, and within an hour, all of the anti-vaxxers came out and had a coherent, organized message and plan. I think we don't do that as well in our field. So I love, hearing integrating in different ways, getting people connected so that when we need to get our messaging out
Right.
or have a coherent message, I think that's a great way to do that.
Right. No, I agree. So as my nieces and nephews say, if you stay ready, you ain't got to get ready. You
Exactly.
know?
Exactly.
But yeah, so I agree. I think that's critically important. Again, understanding to Tareen's point, like if we're partnering with on proposals or programs, then we're starting to integrate how we're talking about tackling, addressing an issue. So it's more we can have those that messaging more readily available. And even if we're doing it individually, right, not a coordinated effort, the messaging is harmonious among the varied organizations. So yeah, I think that's a part of the playbook from sort of the anti-public health movement that we
Yeah.
certainly can learn from and leverage to our benefit.
Yeah, for sure. Okay, I want to pivot a little bit. Mighty, one of the things that I love about the work that you do is how equity centered everything
Mhm.
that you do and you do through APHA. What opportunities do you see for organizations to engage those, historically excluded communities in ways that honor their strengths and their lived experience that we've been
Right.
talking about here,
Yep.
right? And maybe some practical steps that people can take to build those community rooted partnerships.
Sure. First thing that comes to mind, I know these are tried and true, and hopefully people are not tired of them because I found them to work exceptionally well, and it's listening sessions, right? So if there is a topical area that we want to cover and we know that there's a group that has some insight there, it's we my approach has been to actually go and have a conversation and listen. I think sometimes, and I'll even speak for myself, early on in my career, I went in program package, had the solutions ready. I'm like, yes, let's just implement this, right? And I found very quickly that that was not the most appropriate approach because how are you coming and asking for my help, yet you have solutions already in mind, as opposed to posing the question or uplifting the issue area that we're trying to address, and then we collectively generate solutions to what ways to address this problem. So again, just summing that all up into having discussions, understanding what our intention is for engaging community members, and then making sure that there's a feedback loop. So it has to be a return on what's the return on investment for them. I give you all this energy and I give you my intellectual capital and my lived experience and I provide all these insights for you. So what is being returned to me, my community? Folks have directly given compensation, right? That's one route to compensate people for their intellectual property. What we have done, not this year at APHA, but in past years, what I've done, again, sort of like going from inception to conclusion of it, is we worked with communities to address, I can speak specifically about a violence prevention program that we had here in DC. So we engaged with the community, and it was a very specific neighborhood, and we learned what some of the risks were in the community. We understood like what some of the underlying issues were in the community from the people that actually lived there. And I remember one of the most salient pieces from that interaction for me was we were talking about gun violence, and one of the co-presenter or facilitators, excuse me, talked about someone being at the wrong place at the wrong time because they were coming off of a bus in this neighborhood that we knew had a high incidence of violence. They were shot and killed. And as he was explaining, this is one of the stories to help folks understand what's happening while we're there, etc. The mother, who's the survivor of that young man, stopped him in his tracks, and she said, "My son was not at the wrong place at the wrong time. Right? He was coming home from work, getting off of the bus, and walking home." At no point in time should that be the wrong place and time because, and again, it's a very minor issue, but it stuck out to me because it help me to reframe that narrative. Like it almost posits that violence is inevitable. And if you're at the wrong place at the wrong time, then you might get shot in this neighborhood, as opposed to reframing it and understanding it. I want my children to be able to come off the bus, go to school, walk to the store, wherever, without having to worry about violence because we're recognizing that we're not treating that as a norm. So part of the tangent, but my point is having that discussion and that engagement with community and folks with lived experience, including survivors of violence, we were able to shift not only our own thinking around how we address this issue, but also how we talked about it so that we're honoring the lives and we're honoring of those that we lost, but also honoring the lives who are dealing with and contending with these issues of violence in their community. So again, just bringing them in as credible thought partners, doing some power sharing, recognizing like, yeah, you have your PhD, your MPH, that's great. Not undermining those things, but in having that same level of appreciation for people with lived experience, whose experience and understanding the nuances of those communities are able to showcase things that are not in our textbooks or not in the experience that we have and have had in the field. So again, just a way to sum that up is just authentic representation of what public health is hoping to bring to that issue area and recognizing them as credible thought partners in that work, and then making sure that there's a feedback loop. And sorry, on my tangent, I forgot to say is a part of this program is we had some of the community members who collected data, who did the program intervention, who were the popular opinion leaders to present at APHA's annual meeting. So again, they were able to see the full feedback loop of why we came there in the first place, yes, to address the issue, but also how we're sharing the stories that they provided to us. And I felt that that was very empowering for them. And by them having an opportunity to present in that forum, we were able to engage tons more community members who wanted similar experiences.
Mighty, I think you just modeled the power of storytelling. I literally got chills when you told that story, and I think it shows the impact and what our community voices and how we need to hear them more. I think that was really powerful. Thank you for
Of
sharing that.
course. Yeah,
I have
I get so passionate, so I was trying to remember what I wanted to say
no,
as I was telling. There were so many different pieces there, but yes,
yeah.
and as I said, this was several years ago, and it stayed with me to this day. And this is someone who had been doing violence prevention work, and it reframed my approach from that moment.
Yeah. And I think that reframing, we are in a period where we need to reframe a lot of the different things that we do. I think so. That's the perfect word. I love that. I want to make sure that we give time to the audience. So if any of you have questions, please put them in the Q&A or the chat. We want to make sure we address anything that any of you have. While we're waiting to see if any of that comes in, Mighty, you made me think of a new thing. You also talked about kind of having the community involved in the different metrics, evaluation kind of piece. I think another thing, maybe we need to measure our success in a different way.
Absolutely.
And what might that look like? How can we measure our collaboration beyond our traditional metrics? I'd love to hear from all of you what you think about that.
Chris was like, okay, yeah, I thought you
Oh,
were
no, I just, I was just talking and thinking about this the other day with some partners of, it is the active listening, whether it's out in communities or it's within and across organizations, it is very time intensive. You're nurturing relationships.
Absolutely.
And I think the way you measure that is the outcome of who you end up having at the table a few months or a few years down the line. Like, you can connect on LinkedIn, you can build these networks out, but I think there is something to when you're building these deep relationships that are authentic and that are built on trust. It's lots of different phone calls or getting together, and it does pay off because you start to see those faces in different spaces. And I think that is the measurement for success is if I start talking to people today, next year, what does it look like when I'm hosting something or at a conference or out somewhere doing something? You start to bring those people in, and I think that is how you begin to really make sure that you are doing the work and that it is sustained. They show up later on.
Yeah. I agree. I think you're speaking to sort of those sustained partnerships, right? Where you are able to see the longevity of them, even if you're not interacting regularly, but there was enough of an impact and there was enough of a return on investment that folks feel a desire to want to continue in that work and collaborate with you. So I think that is sort of underappreciated is and I think that's a great way to measure success of the work is if folks are willing to come back to the table when you call them.
Yeah, and I'll just add one that we've been using here at Save Kids is that who's not at my table that should be, uh,
Sure.
just so that we
Taurine, we're having a little bit of trouble hearing you.
Oh, can you hear me now?
Yes.
Okay. I said it's what we've been doing here is understanding who isn't at our table to better understand that we have to be more outward and bring in those that may not feel that they should have a seat at the table. And I'll just use one example. Many know that we partnered with Scholastic to do these Clifford books. And the important thing for us to do that Clifford books were, while we could join in and buy books that were already done, we really wanted to get some of the messaging that we say to families in books that resonated with communities. And so we started to really center ourselves as an organization because I'm sure many of you know there's been stories about Safe Kids and how Safe Kids intersect in the environment of public health. And so it was really important for me in the organization to really step back and take a look with the team to really understand we have to lead through, an academic lens. We have to lead through the research to create the solution to the problem, which is developing very evidence-based, impact-driven programs. And so we had to step back and measure, our performance around identifying three KPIs and really recognizing one of the bigger ones, who's not at the table and who we're not talking to. And so that's been really, I would say, revealing for us and has led us to really year over year evaluating how we do our work and making sure that we're getting voices that we typically may not have had at the table or have explored bringing to the table.
I love that, Taurine, showing how intentional you were about thinking about the voices that aren't there, I think is really important. We did have a question in the chat that I want to make sure we get to. How can we encourage cross organization and cross sector collaboration when many folks who are also doing this work still see the pie as limited and may see others as possible competition for funding? Any thoughts on that?
Ooh, that is a real thing. That is so real. Um, I think that this is the direction public health evidence was marching us towards. It's all those upstream factors that we knew were going to shake up the landscape, and we were starting to see some funding in that direction. We know housing is public health. We think about climate change, like that was starting to happen. And I think though by creating these intersectional networks and having injury in spaces like Mighty brought up earlier, and HIV, or thinking about where injury is placed across, there is going to be some seeding, right? Because it's going to take different people wearing different hats to solve some of these big problems. And we are now in, potential resources being constricted. And it will be hard. And I think some people are going to have a challenge. But to Trent's point earlier on, like there's such a shakeup, there is an opportunity for new change and new growth. And we need to be able to pivot. And I think that this might accelerate that because we have to be reaching across and thinking about our work in different ways. And it's just naturally going to have to follow, or the field is going to have a challenge.
Mhm.
Trust. This is a time to rebuild trust with everyone. And instead of, looking at being a competitor, how about we start trying to look at how to be more collaborative? I mean, we're all doing the same work in some capacity. It's just, I think you're stronger with numbers. And I know, this may sound, Pollyanny, but I feel like this is an opportunity. Like, I think we all are doom and gloom most days because of the news and everything we hear, but we have to pull ourselves up because we're bigger than that and we can do it. And I think we have to take this space to really elevate those. I mean, when I think about data now and I think about the data sets we would pull down and we would look at, I mean, they're not there anymore, but to Mighty's point a minute ago, I mean, they're doing research intersectionally within their organization. And what does research do? Sometimes it sits on the shelf. It doesn't get taken to practice. So how do we start to really see what we haven't really dug deep to see what's out there and start calling one another, sitting with one another and understanding. I may not have known what APH did 2 years ago or 3 years ago. This is a time to ask when the places we typically would go are no longer here for us to go to.
Absolutely. And adding to what you both shared, I think it's critically important now for us to be willing to do some deep introspection within our organizations and what I like to call a programmatic purge. There are some great programs that we do and they're great to have, but are they really necessary to get us to your point, Tarine's point earlier, what outcome are we trying to achieve? And there are some things that may help facilitate that in one way or another, but are they really critical for us achieving the goal? And I think if we're willing to do that deep introspection and do that programmatic purge internally, that opens up the space for us to partner with folks who, like you said, are better at number crunching or better at getting community involved or has researchers on tap. So that way we can see how we're all aligned to get to this end goal. I remember back in the day, we used to have this partners matrix, and it would be like, who's a partner? What is their skill set? What can they bring to the table? How long do they need to be involved? And I'm not saying we need to go back to that, but I do certainly think that can be used as a starting point for us to think critically about who these partners are, what are our goals, and again, overemphasizing being okay with maybe losing some money for that pet project that really didn't have much significance other than we did it all the time, and open space for those funds to be funneled to an organization, again, that's going to get us to the greater goal of what we're all working towards anyway.
Love all of that. I could talk to the three of you all day, and I have in some cases. I but unfortunately, we're coming to our end here. We have just a couple minutes left. So, in a really quick answer, if you could tell the audience, encourage them here to take one meaningful step in the next 90 days to stay connected and keep this work moving forward, what would you tell them? Mighty, how about you first?
Sure. I don't know if this directly answers your question, but my point is to continue or to take up space. Public health, we're often so humble and we say, you don't need us until you need us, or you don't know we're available. And I think we have to humbly take up space and acknowledge that we have expertise, we have knowledge, we have experience, we have educational background, we have lived experience, etc., to really address some of the major issues that we are facing, specifically to injury and violence prevention and beyond that. So be okay with acknowledging that you are a value add to addressing this issue. So however you can do that in the next 90 days, make sure you take up space somewhere.
I'm going to align with Mighty because I was going to say take risk and use your voice and know that it may not be the conversation that aligns with your expertise, but using your voice to insert yourself into the conversation allows you to do exactly what Mighty said, is take up the space to really, I would say, start to propel and start talking more about what we do and how we do it and using it in plain language. I think the more we can use plain language, the better we're going to be with getting people to understand what injury prevention is. I know someone put in a chat, getting people to believe it can happen to them. I think all of us in injury, the hardest part of our job every day is getting a parent to believe or a child to believe that it will happen. It's just when. And so, really using storytelling and lived experience so that, I think a tragedy that happens and turning pain into purpose helps others to understand. So, I think our job is hard because we're preaching and we know we want people to understand it. But I think the more we can use our voice in places that is not really always heard, it helps to be heard.
Um, Taking up space, taking a risk, two critical things that I think you can do easily in the next 90 days. And I think to add to that, it's like take a phone call, reach out to someone, see who's not at the table, or, we sometimes have those piles of business cards and you're like, I got to get around to that. Like, make a connection and invest some of that time. I think we all feel very stressed for time right now, but having those 30 or hour long conversations around the work that's being done, who's out there doing that, can really unfold opportunities, and pay out big time. And I think it enables you to also feel stronger because it's like there's other people out there. Like, I think every single one, I was just at PrevCon, I was just at APHA, I'm currently at the firearm conference. Like, you are in a room with these people and we all feel this strength afterwards. So in the next 90 days, if you can just share space with someone new, learn about what they're doing and connect with them, I think that is going to really go far.
Absolutely.
I love all of those answers. Okay, we're coming down to the last minute or so here. Unfortunately, we have to close the conversation. And I want to thank each of the three of you. It was a fantastic conversation. You brought so many great points. Thank you to our panelists, but also thank you to all of you who came today to listen in. We know this isn't an easy moment for our field right now. and all of the things we talked about. But what I am reminded today after this conversation is we're not carrying this weight alone.
Mhm.
Collaboration is not just important, it is going to be our lifeline and our way forward. So I really hope that you got some ideas today of things that you can think about in different ways we can collaborate, support one another, lift each other up, use our voices, all the things you heard here. And, we've seen our field. We know it's resilient, it's creative, it's full of people who are committed and passionate about what they do every day. So let's keep this momentum going forward. I want to end with a call to action. Um, in the chat, or you will see the poll. What is one concrete action you will commit to today? So please make sure you answer that. And while you are answering that, I just want to tell you about a new toolkit that Savers Safe Kids Worldwide and Injury Free created called the Year of Action Toolkit. It has easy to do, flexible ideas to help all of us stay connected, to elevate injury prevention, and to share resources and keep these conversations going throughout the year. The toolkit reminds us that the day is over, but we need to keep continuing our momentum, right? And then they also have a year of action pledge. So by signing the pledge, you're committing to carrying this energy into the next year to connect with partners, raise awareness, advocate for safer communities and continued funding, and to take small actions that add up to real change. You can find that on the National Injury Prevention Day .org website under Year of Action. And we want to thank you again for spending this time with us and for everything you do every single day. Please take good care of yourselves, stay connected with one another, and keep doing the work that matters. We appreciate each and every one of you, and we are glad to be in this with you. Thank you all. Have a wonderful rest of your day.
Thanks, Tracy.
Thanks,
Thanks,
everyone.
Tareen and Kristen. Bye bye.
Thank you, everyone.